can't believe that this is happening again. I don't know what's wrong with me. I'm not supposed to be on my period yet, but just like last month, I'm having it twice a month, and it's lasting longer than usual. I'm really worried that something is wrong. I don't want to tell anyone because I'm so embarrassed that this is happening.
Abnormal uterine bleeding can refer to amenorrhea, irregular periods, or infrequent periods. It can also refer to the menstrual cycle being fewer than 21 days or more than 35 days, or a menstrual flow greater than 7 days. It also includes abnormally heavy bleeding and bleeding between cycles.
Is that you, Anne?
Taylor, I'm so glad you're here. I'm so embarrassed and I don't know what to do.
Well, we've been friends forever. You don't have to be embarrassed. What's wrong?
Well, I've been on my period a lot lately. It started out being once every 3 weeks, but now it's twice a month, and I'm really scared that something is wrong.
Well, have you messed around with Jake? I mean, you could have an STD or an infection or something.
We have fooled around a few times.
Well, that could be it. Or I did also read an article that said that bleeding down there is a common sign of cancer.
Cancer? Stop! You're freaking me out.
You need to tell your mom.
Yeah, you're right. I'll call her tonight and hopefully she'll know what this is.
Although endometrial cancer is a rare possibility in younger females, more common causes of normal uterine bleeding include pregnancy, miscarriage, hormone imbalances, uterine fibroids, systemic illness, stress, polycystic ovary syndrome, uncontrolled diabetes mellitus, thyroid dysfunction, or the use of antipsychotics or antiepileptics. In the absence of illness, excessive physical or psychological stress or a body mass index of less than 18.5 or greater than 25 are associated with abnormal uterine bleeding. Amenorrhea is generally associated both with underweight and obese women. Because obese women are generally associated with polycystic ovarian syndrome, they tend to also have irregular periods.
Hi, honey. How's your first semester of college going?
Hey Mom, my roommate Taylor and I are getting along really well. School is crazy, but I'm surviving.
Good. I'm happy to hear that. So how is everything else going?
Mom, I have something to tell you, but I don't want to make you nervous. I've been bleeding like I've been on my period for several weeks out of the month, and it's been heavier than normal, and I'm really worried that something is wrong. Taylor thinks I have cancer based on a magazine article that she read, and I'm just really scared.
Oh, honey, don't jump to conclusions. Have you even seen a doctor?
No, I haven't.
Okay, well, when you come home this weekend for your sister's birthday, we can go to the nurse practitioner that I go to. Don't be worried. We'll figure out what's going on, and it could be something that's easily fixed.
In addition to lab work, common assessments when presenting with abnormal uterine bleeding can include a pelvic examination or a pap smear. The healthcare provider will also look for any signs of trauma, cervical polyps, or abnormal tissue. Some side effects of low estrogen 24-FE include abdominal cramping, breast tenderness, acne, dizziness, fluctuations in weight, and upset stomach. If any of these symptoms become severe, you should contact your healthcare provider. If you experience shortness of breath, swelling and pain in the lower extremities, numbness or weakness on one side of the body, contact your healthcare provider immediately, as these could indicate severe complications. If you or someone you know is suffering from abnormal uterine bleeding, you are not alone. Seek help and call your local healthcare provider as soon as possible. There is help available, and nothing is too embarrassing when dealing with your health.